Hi, in this video we'd like to discuss when you should seek treatment and what signs to look out for hyperemesis gravidarum. So a lot of patients come to us sometimes in their first experience, second experience. They are not aware that they are experiencing hyperemesis and they are not aware that they need to seek treatment. And sometimes this can affect their pregnancy and then also potentially threaten maternal life, fetal life. So here at Antai Hospital, we want to prevent that from happening because we do offer highly effective treatment for hyperemesis. The recovery is rapid and the effects are instantaneous, which is why we want to educate you to look out for signs of hyperemesis so that you yourself may prepare yourself. So many women are completely unaware of hyperemesis because only less than 3% of women experience HG. So unfortunately, you may encounter doctors and fertility experts that may also undermine your hyperemesis because first of all, they have no awareness. Secondly, they believe that it's completely psychological. They don't give you the full treatment that you need. They also are unable to give you effective treatment, only give you treatments that suppress your symptoms, suppress whatever you are experiencing, and you need to be dependent on these medications. They also can cause some side effects which are pretty nasty, and you need to have them throughout the entire pregnancy. So these are all very detrimental. So what are the first signs that you need to look out for hyperemesis? Is the sign of dehydration, excessive salivation, insomnia, and nausea. These are the 4 symptoms that you need to look out for. If you have very dry lips, if you see that your urine color is especially dark, you feel like you're constantly thirsty, losing a lot of fluids, having constant headaches, much more severe than your usual ones, and persistent, being unable to sleep, completely sensitive to your environment, even to people you encounter with, this could already be a sign of hyperemesis. You need to be quickly adjusting yourself and go and seek treatment. You may also need to educate your friends and family on hyperemesis because they themselves may think that it's non-existent or maybe it's simply morning sickness. So share them these videos that we do at Antai Hospital's YouTube channel. Let them watch these videos, let them know that hyperemesis is nothing to be underestimated about. So next signs that you need to look out for is that you experience weight loss throughout a few months. You are not supposed to experience any form of weight loss with morning sickness, but with hyperemesis you may experience weight loss, and you need to keep note of that. Furthermore, you may also experience emotional instability and also depression that is persistent throughout the pregnancy. Furthermore, another thing is that you realize that this vomiting, this nausea is not going away. It's beginning roughly around first trimester, week 5, week 6, but morning sickness usually persists until week 12, week 13. If it happens after that and consistently persistent and even increasing in severity, it may well be hyperemesis gravidarum. So you need to be very well aware about these things that are happening, because if you do not observe these symptoms carefully, it may be the difference between having a successful pregnancy or having another potential miscarriage that can be avoided. So these are some of the symptoms that you can look out for. If you want to find out more information on exact symptoms, when to look out for, what kind of diagnosis and examinations we do at Antai Hospital, we've written a very good article recently that you can find out in our website. Antai Hospital offers you full contractual treatment, money-back guaranteed treatment for hyperemesis gravidarum. You yourself will observe that you can recover immediately within 2 to 3 days, but of course we do need to hospitalize you for a few days longer just to observe that everything is stable. Our HCG-Desensitizer not only is easy to administer, it's effective, and it comes into effect very quickly, and you do not need to depend on these medications for long. All you need to do is receive these treatments within that 1 week of hospitalization, and once you are stabilized, there's no symptoms anymore, and then you are allowed to go home. You can have a smooth pregnancy afterwards. So this is all a reality here at Antai Hospital. Hyperemesis gravidarum can be treated, and there is a treatment out there that is effective, no side effects, and can stop hyperemesis. Get in touch with us via the website if you'd like to find out more information. If you'd like to seek the treatment, you can also set up an online consultation with us.